Ladies and gentlemen, thank you for standing by. My name is Daphne Worrell, Marketing Manager for ODG by MCG, and I'm excited to welcome you to today's webinar introducing the new ODG by MCG. During this webinar, all participants will be in listen-only mode. If you'd like to ask a question, please use the chat feature located in the lower corner of your screen. We'll save some time at the end for some questions, and any questions we don't get to, we will get back to you following the webinar. The webinar is being recorded, and the recording will be sent to you within 1 week. Our presenter today is Ingrid O'Keefe, Director of Business Development for ODG by MCG. Ingrid develops and maintains strategic partnerships in the work comp, short-term disability, and auto insurance markets. Ingrid has worked for 12 years in the delivery of evidence-based guidelines and claims analytics. Ingrid lives in the San Diego area with her husband and 2 children. So Ingrid, you can take it from here.
Thank you, Daphne. Okay, and just to confirm, can you see my screen?
Let's see here. I do see it on one screen and not the other. If anyone doesn't see the Ingrid's share screen popping up, you may need to refresh your browser. But it looks like it is working now.
Okay, perfect.
Oh, great.
Thank you for joining us, everyone, and welcome to the April Intro to ODG by MCG webinar. I will today be walking you through our web-based solution, ODG by MCG. And keep in mind that anything you see here today can also be integrated or automated into your claims or EMR software platforms. So ODG by MCG essentially is broken into 3 key areas of content, and those include duration or return to work, medical treatment, and cost. And we really see these 3 areas as being interrelated because the longer that a person is out of work, the higher the cost of that claim becomes. And really some key ways into mitigating time out of work and claim duration are both by using evidence-based return to work guidelines as well as return to work management tools, and by identifying appropriate medical treatment. Now, we have taken a tab-based approach into organizing the content within our site, and that's really in an effort to bring the content out to our clients and make it readily apparent to them all of the information and tools that are available. Now, each of these tabs correlates with one of the 3 key areas. So duration correlates with duration, medical treatment is encompassed by treatment, TAU index, and formulary. Cost correlates with cost. And we've added a job profile tab, and this is a tool that can be used to assist in the return to work management process. Now you can search this site a variety of different ways. I think the easiest and the most obvious way is just to type in whatever you're looking for into the search bar. So here I could type in a condition like carpal tunnel syndrome, for example, and as I key in a search term, you'll notice that results are populated underneath. You'll also notice that any of the tabs that have relevant data associated with your search item are highlighted with a check mark. I also have the option to search by a medical procedure. So I could search by a term discectomy, for example, and that would then retrieve the projected disability duration, return to work, and cost. Or I can look up a treatment guideline for discectomy. Now, if you have a diagnosis code, it's possible to search by a code. You just need to enable that functionality up here. So the system automatically assumes that you want to search by a medical topic. However, if you prefer to enter in a specific code, you can again enable that functionality. Some other quick ways to search, if I scroll down a bit, you'll notice that there is a body diagram. And here, if I hover over any of the nodes on the body, I could click on this node and it would pull up the treatment guidelines correlated with that area of the body. There are also a list of the top 15 return to work diagnoses, so I could click on these, or a list of the top 15 medical treatments. Additionally, we've added a tool called Top Conditions. So if I click on these binoculars, it brings up a list of the top 100 conditions. So here I could click on back sprain, for example. And once I click on or choose a medical diagnosis, the duration screen is populated with the projected return to work guidelines. And these are provided at two different data sets. So the first is the B, or your best practice value, and the second is your average value. Now, a little bit of background information for those of you who are not super familiar with ODG. Where this information comes from is our collection and analysis of about 10 million lost time cases. So ODG collects data from several different resources. Those resources include data from cooperating workers' comp insurance carriers, third-party administrators, self-insured employers, data from short-term disability insurance carriers, as well as some national resources like OSHA and the Center for Disease Control. So this A value, the average, this is the normative data. So this represents exactly what all that data indicates. So on average, a person with a back sprain is out of work for about 19 days. This B value, or the best practice, this is really a goal to aim for. So this is essentially your optimal return to work time frame. This is the value that you would want to manage towards. So you would ideally expect a patient to be back to work within your target or your best practice, or somewhere in between your A and B value. Now this B value, this is informed by all the data that we've collected, but it's also a bit of a recommendation. So ODG has a clinical editorial team that reviews all the data based on what the data suggests, and based on their clinical expertise, they make recommendations for target best practices. Another item I will point out is this ODG risk assessment score. This is a predictive modeling tool that scores the relative risk level of a claim on a scale of 1 to 100, 1 being the lowest level of risk and 100 being the highest level of risk. And what we mean by the term risk is the likelihood that this will become a high-cost claim, a problematic claim, or potentially a claim where the patient doesn't return to work at all. So you can use this tool in a variety of different ways, and different organizations use it differently. You might use it simply as a way to help prioritize your claims or case management efforts. You might also use it as a way to segment your claims. So perhaps one adjuster would manage 3 to 4 claims that are in that low to moderate category, and another may handle one claim that falls within that high category. Now, there are several different factors that influence this risk score, so I can account for all of those by clicking on this Refine button. And here, I can enter in all the claim-specific information. So I could account for the claim state. I could account for the age. You also have the option to segment the data. So here I'm looking at the mixture of all the occupational and non-occupational data. If I wanted to, I could just look at workers' comp data or non-occupational disability. You'll notice that this lists 9 different confounding factors. So you can check any of these factors. And the reason that we've included these 9 specific factors is really for 2 reasons. Number 1, they're some of the most common occurring factors, so for ease of use, it's easy just to check these off. And number 2, we have found these to be some of the most impactful factors in terms of influencing time out of work. So maybe I know, okay, this patient is also obese. I could check this obesity. And you're not limited to these factors. You can account for any other conditions the patient might have by searching them out within the search bar. So it could be a work-related condition, or maybe it's some kind of comorbidity or underlying condition that you're aware of. So I'm going to search out knee strain. And then I can select from the options underneath. And I'll go ahead and close this, and we'll also input the claimant's age. And now that I've input these other factors, like the obesity, the age, the state, you'll notice how that influences both the return to work projections and the risk assessment score. Now, another thing I'll say about the risk assessment score is that For some claims and case managers, they have a lot of experience, so it's readily apparent to them the claims that are going to be high-risk claims or potentially be problematic. But sometimes there are things that are not readily apparent, and that's really where this tool adds value. Okay. Now, one thing we haven't accounted for so far is the type of job that this employee is returning to. So I can do that two different ways. So I have the option to select a specific job class. So maybe I know the patient's returning to sedentary, light, or medium duty. And all of the job classes here adhere to the Department of Labor definitions. So if you're not familiar with what those are, you can kind of hover over this and it will define it for you. Another option, and this is a new enhancement to ODG by MCG, is you can enter in the exact job title of the employee. So maybe you're looking at a claim where the patient is a nurse practitioner. And as you start entering in a job title, options will populate underneath. So I will select nurse practitioner, and then I'll go ahead and close this. And now the return to work projections are projecting to the exact job duties of a nurse practitioner. So this is return to work full duty for a nurse practitioner. Now, if there are sedentary or light duties, modified duties that are available for this patient to return to, you could, of course, override that by selecting one of these options down here. You'll notice that once we entered in the job title, the job profile is highlighted with a check mark. So I'm going to click over onto this tab. And once I open up the job profile, this gives me a full description of exactly what a nurse practitioner does in their day-to-day duties. It also gives me a job demand score. And this is also a tool that scores the job demands on a scale of 1 to 100. So it's looking at the physical demands of the job, and then it uses a proprietary algorithm to come up with that demand score, and that helps us tailor the return to work projections to the specific job duties of, in this case, a nurse practitioner. At the bottom of the screen, it gives me a list of the physical demands. So it shows me how frequently per shift a nurse practitioner is balancing, carrying, gripping, etc. So you have the option to keep this as it is, or you could customize your job profile. That would allow you to tailor the return to work description, make modifications to the physical demands. Once this is completed, you can go ahead and approve it. And after it's approved, you have the option to share this, and you can share this a variety of different ways. So you could either share it by email, you could create a PDF, you could print it. So this could be shared with the employer, for example, so it creates awareness surrounding what exactly the employee is doing on their day-to-day jobs. Are they able to return to those duties? If yes, that's great, and if not, perhaps they could identify an alternate job that the employee could return to as their injury or condition heals. I'm going to click back on the duration tab. And we talked a little bit about sharing information from the job profile. You can also easily share information from the duration tab as well. So there's different ways to do that. Number one, you could hit print. I could print this page, or perhaps I want to create a return to work prescription. So I'll go ahead and include a diagnosis. I can include more specific information about the claim, like the employee name, claim number, physician name. I can insert the recommended comments. And then we automatically default to the target best practice return to work duration. If you prefer to manage towards the average, you could select this value. We include some capabilities and activity modifications, and you could include these within the return to work prescription. It's completely optional. And then that job description from the job profile is also incorporated into the return to work prescription. So here I can create a printable document. And what this does is it creates an ODG return to work prescription. And this is an easy way to export and share the return to work recommendations. So you could use this to share with any of the stakeholders involved in the claim. And the idea is that it creates a goal and you're working towards a shared goal, and in this case you're working towards that best practice. So for example, you could share this with the treating physician. If they agree with it, they could sign off and date this form. And if not, that's okay too, because it could kind of create a dialogue and perhaps bring to light some things that are going on that you were not aware of. I've also included an optional ODG job function evaluation form. This is an optional form, again, that can be completed manually, so it includes additional information on when the employee can stand, sit, kneel, bend, push, etc. And one nice thing about ODG by MCG is that everything is configurable. So you can keep this form as it is, or if you wanted to incorporate your own company logo in place of this ODG by MCG logo, for example, or perhaps you have a state-specific form you would like loaded into the system, we can do that on a client-by-client basis. Okay. So looking back at the Return to Work screen, another way that you can share information from this screen or kind of note it for yourself is use this copy URL functionality. So this creates a unique URL that would bring you right back to this page. So if you're operating within a claim system, for example, you can create a URL, copy and paste it into your notes field, and then if you come back to this claim and you need to add or modify information, you can simply click on this URL. It'll bring you right back to this page, and that eliminates the need for having to re-enter in all of this information. You could simply add to it. Maybe down the line you realize, oh, this patient needs surgery. You could just plug in the surgery up here and then get that modified return to work projection. A few other elements I will point out on the screen is the return to work management timeline. So this shows you the initial day out of work, the average time out of work, your target best practice, and then it suggests that in order to achieve that best practice, you should issue a return to work prescription on or before day 21. There's also some high-level clinical content. So if you wanted more information on any of the conditions, we incorporate 3D animated videos, or we link to web-based resources. So here I could link to Medline Plus, for example, and it will give me information on knee pain and just kind of high-level clinical content that can be used just as a refresher or to inform yourselves, or it can be used to share with patients so they can become more informed on their condition. And coming soon, we will also be including high-level clinical content for the top conditions, and that will incorporate kind of questions to ask if somebody's failing to recover and just high-level useful information. Now, you can use these computer-generated values, which we would recommend because these are taking into account all aspects of the claim, or we do also believe in human intervention, so you could manage using one of these return-to-work scenarios. So perhaps you have additional information about the claim. You could highlight one of these scenarios, which will then in turn change your target or your best practice days. If I scroll a bit further, you'll notice that we list all of the different ICD-10 and ICD-9 codes that correlate to the medical topics that you searched out. So with this system, ODG rolls all the codes up to the medical topic level. So you now have the option to search by a medical topic, or again, if preferred, you could certainly search by a code. Included are some recommended activity modifications, and these are defined according to the injury. So here it gives you recommendations for modified work when looking at the lumbar sprain or the knee strain. And then finally at the bottom of the page, this includes high-level physical therapy and chiropractic recommendations in terms of number of visits. And what we found based on client feedback is kind of the key things people want to know when they have a claim is how long will you expect the patient to be out of work, and then how many PT or chiropractic visits can I expect. And so here you can get all of that just right here on this duration tab. So next I will click on the cost tab. And when you're looking at the information here, it's giving you the projected total cost of this claim. So what is driving this cost is all of the information that we've entered up here. So we're looking at this California claim for a 45-year-old who's obese. This information stays pinned to the top of your screen. So the total cost for this claim is about $15,575. This is a sum of the indemnity, medical, and expense and administrative costs. The indemnity costs are projected based on the time out of work that ODG indicates. We're taking those return to work projections and multiplying them by 2/3 of the average weekly wage. Average weekly wage is determined by the state that's entered. So in this example, we're looking at California. If you know the actual weekly wage of the employee, that can be keyed in up here, and then that will modify your indemnity projection according to what is entered here. So it will multiply by 2/3 of what's manually entered. Now, keep in mind this tool is geared towards temporary disability. It does not factor in permanent disability or permanent payouts. However, it does factor in any state-specific waiting periods and state-specific maximum weekly TTD payouts. So if you had an employee that has a very high weekly wage, for example, it would calculate based on that max weekly wage. The medical cost projections, these give you an overall projection of what you can expect for medical costs. Now, one of the most common questions I get about this tool is, well, could the costs be segmented so I can see how much I can expect to spend for physical therapy versus medications? And the answer is no, it's not that granular, but it does give you a good overview or kind of 30,000-foot view of what you can expect to spend. So if you're using this to assist in setting reserves into buckets, all of your buckets should add up to this overall medical cost. Expense and administrative costs, these are the projected administrative, any surveillance, legal expenses that you might see. Now, if this is a medical-only claim, you have the option to select medical-only, and that will do a couple of things. Number one, it will remove your indemnity costs because there would not be any indemnity costs. It also reduces the medical costs pretty significantly because what we found is that one of the best things that a patient can do is return to work. That eliminates the likelihood of them developing a disability mindset or getting caught in a treatment trap where they're receiving treatment after treatment or prescription after prescription that may or may not be effective. So I'm going to go ahead and uncheck medical only. And let's say that this patient ends up having surgery. So I'll go ahead and enter in discectomy, select lumbar discectomy. And now you'll see the cost projections. They incorporate the surgery. They also take into account additional time out of work that you would typically see associated with this surgery. So your medical costs now encompass the surgery, but also any surrounding costs you'd typically see with the surgery, like more physical therapy or additional medications. And the cost projections here are projected to your typical cost. You have the option, if you want to kind of tune your cost projections up, you can do that, or tune them down. So maybe you know this patient is really motivated to return to work and you might want to tune your cost projections down, or you can just leave them at the typical cost. So next, let's click on the Treatment tab. A little bit of background information on the ODG treatment guidelines. They are organized by body systems. So if you open up body systems, it gives you a list of all those that are addressed. There are some specialized chapters like pain, for example. And here, because we have searched out conditions related to the low back and the knee, we're pulling in all the treatment guidelines from that knee and leg chapter and the low back chapter. You have the option to filter by recommendation type. So ODG has categorized each recommendation into one of 3 different types. So treatments are either recommended, not recommended, or under study. So perhaps I just want to see, okay, which treatments are recommended. I can filter by recommended. You also have the option to filter by category. So maybe you want to see, hey, which injections are recommended for the knee and leg and the low back. So now I'm viewing a list of all of the recommended injections. And then I can open up a specific treatment guideline, and I'll open up epidural steroid injections. And here you can see that these are conditionally recommended. Following the recommendation type, it gives you the high-level treatment recommendation, and then it gives you the patient selection criteria. And what this means is that in order for an ESI to be recommended, the patient should meet this criteria outlined in blue. Underneath the patient selection criteria, it gives me a summary of the clinical evidence. So here it also includes links to full citations of the study that's supporting this recommendation, a link to the PubMed ID, which I can open up, and then this gives you a full abstract of the study. So if you are using ODG to advocate for or against the effectiveness of medical treatment or medical necessity, you can highlight and copy and paste information directly from the abstracts, or you have the option to copy and paste directly from ODG. And then, of course, there's still the print functionality or the copy URL functionality. And that's kind of the roundabout way of finding information in ODG. You can also just type in a specific treatment guideline that you're looking for. So maybe you want to see, what does ODG say about platelet-rich plasma, for example. And I'll go ahead and open this up for the knee and leg. And you'll see that platelet-rich plasma is conditionally recommended. It gives you the recommendation statement, patient selection criteria, and here it also outlines the risk versus benefit. And you will see risk versus benefit most often in kind of surgical interventions, or in an example like platelet-rich plasma. Underneath this, again, it gives you a summary of the clinical evidence. So now you're pinning both of the treatments that you sought out to the same page, and you could either print these or copy them and use them to share, again, in advocating for or against the effectiveness of medical treatment. So I think you get the idea that the treatment guidelines in ODG are really procedure-driven. So if you have a case or a claim where the patient's out of work for an extended period of time, perhaps beyond what ODG indicates, maybe you want to take a look at what types of treatments are being recommended or prescribed, and then you could seek those out within the treatment guidelines and determine if they are proven to be effective or not based on peer-reviewed scientific studies. So it doesn't give you kind of a recommendation if you were to look up an ACL tear, for example. ODG doesn't tell you what to do first, second, or third, but it would address all the different treatments that could be performed for an ACL tear, and it would tell you whether those are proven to be effective or not based on peer-reviewed scientific studies. So from here, I'm going to click on the home screen. And anytime you click on home, it will clear out your search terms. And I'm going to go ahead and click on this back sprain topic and jump over to the TAU index. And TAU stands for Treatment Analyzer on Outcomes. And what's driving the information in this tool is a collection and analysis of about 5 million workers' comp insurance claims. So this is providing a list of all of the different procedures that could be performed for a back sprain. It's providing information on the procedure name, frequency, number of visits, costs, and really kind of the three most valuable components of this tool are the payment flag, the authorization number of visits, and the TAU index. The payment flag is a color-coded flag system designed to streamline the treatment approval process. So there are 4 different colors of flags. There's green, yellow, red, and black. Anything that's green indicates that it's a procedure that is categorized as an evidence-based approval. So that means that there are high-quality, randomized controlled trial studies proving that these procedures are effective. and ODG would recommend automatically approving these up to the authorization number of visits. It doesn't mean that additional visits or procedures would not be approved, but just that a minimum of that number can be automatically approved without looking at any specifics. Anything that triggers a yellow flag, this is what we categorize as a data-driven approval. And what that means is that there are not those high-quality randomized controlled trials proving that these are effective, but we know based on our collection and analysis of all these workers' comp claims that these procedures are commonly performed with positive outcomes and minimal cost. So ODG would recommend automatically approving them. And again, with the yellow flags, you recommend automatic approval up to the authorization number of visits. Anything that triggers a red flag, that's what we categorize as route for review. So it doesn't mean that a red flag procedure is inappropriate. It just means that you should look at the specifics of the case in order to determine if it's appropriate or not. So work conditioning is a good example. It's something that might be very effective for some patients, depending on their criteria, and maybe less so for others. Most surgical procedures will be something that you'll see as a red flagged procedure because you wouldn't want to just go ahead and do surgery on any patient. However, if they have certain criteria, it would make sense to approve it. Anything that triggers a black flag, those are for procedures that are generally not recommended according to ODG. And we categorize these as route for review with extreme caution. So a black flag procedure is something that you normally would not see or should not see. Okay. And then finally, we've incorporated a Tau index score. So being in the workers' comp industry, we have access to outcome data, and that data is return to work. So what we've done is analyzed how each of the procedures correlates with return to work. And we've given each procedure a unique Tau index score, and that's on a scale of 100 in the positive to 100 in the negative. So the higher the Tau index score is in the positive, that means the better the return to work outcomes are that are associated with that procedure. The lower the Tau index is in the negative, that means the worse the return to work outcomes are. So essentially, any score that's in the positive means that the return to work outcomes associated with that procedure are generally good. And I always use the example that if you were to trigger a red flag, for example, procedure, and it has a positive Tau index score, maybe that's something you'd be more likely to approve. So this is a great tool to kind of see at a glance which procedures are recommended according to ODG or not. So if you want to, kind of look at this really quickly, you could see, okay, maybe I have a green or a yellow flagged procedure. That's something you can move forward with. If it triggers a red or a black flag, maybe that's when you'd want to go to that additional level of information and look at those full text treatment guidelines that we just reviewed. And the final tab incorporated in ODG by MCG is the formulary. So how the formulary was derived is we took all the treatment guidelines related to drug therapies, pulled them out, and put them in easy-to-interpret and easy-to-utilize formulary. So the first column indicates the class of the drug. The second indicates the generic name. Third is brand name. Notes, we try to keep these to a minimum, but we do include notes where necessary. Generic equivalency tells you whether there is a generic equivalent of each drug approved by the FDA or not. Status is the most important column. So there are two different statuses. There's either Y or N, and Y indicates that the drug is recommended as a first line of treatment. If it's an N, it means it's not recommended as a first line of treatment. However, it doesn't mean that this is never recommended. It just means there might be other types of drugs or other types of therapies that are recommended before this particular drug is tried. And then finally, costs. This gives you an idea of the cost of the drug. And you can find more information related to the cost by clicking on the formulary info. And you'll find that the cost per drug kind of vary depending on number of days, number of doses, et cetera, but all of that is incorporated when you click on formulary info. And you can filter this a variety of different ways. So maybe you just want to see filter by the class of the drug. You can filter by opioids. You have the option to expand any of these lines, and it will give you a full treatment guideline recommendation so you can see the clinical evidence that's supporting this drug status. You can also search by drugs using the filter. So if you're looking for a particular drug, you can search it out using this filter box. Additionally, there's the opioid MED calculator. And here you have the opportunity to enter in how many milligrams per day of each of the following drugs a patient is taking. So maybe they're taking 100 milligrams of codeine, maybe 20 MCGs of fentanyl, and then this will show you the morphine equivalent dosage for each of the unique drugs as well as the combined total. And if I scroll down a bit, it gives you the ODG opioid dosing guidelines. So ODG recommends caution for any patient taking more than 50 MED and does not recommend that any patient take more than 90 MED. I'm clicking on the Home tab, and we've covered all of the different areas of content and tools within the site. Would like to spend a moment or two talking about our help and training programs. So at the top of the screen, there's a drop-down menu, Help and Training. We offer self-paced training, so these are self-paced tutorials or video-based. Also, if you don't search anything out in the site and you click on a tab like duration, for example, there's a short 2 to 4 minute video that will walk you through how to use each tab, how to interpret the content within each tab. We also recommend coordinating training with our team. So we have an implementation specialist, and we can do web-based trainings, which I'm sure everyone is doing web-based right now, but certainly in the future, then we can get back to doing on-site trainings. But we can tailor a program to meet your specific training and implementation goals. And that kind of wraps it up from me. Daphne, are there any questions that came in?
Yeah, thank you so much, Ingrid. That was great. Here's a question. I currently use the legacy ODG version. What would you say are the key advantages to ODG by MCG? Are you on mute, Ingrid?
Daphne?
Oh, can you hear me? Ingrid, are you muted?
Okay. Well, I don't know if anyone typed in any questions into the chat. I don't have visibility into that. I don't know if perhaps Daphne's having connection issues.
Ingrid, can you hear me now?
What we will do is if any of you did type in a question into the chat menu, we will certainly get back to you by email. And we appreciate all of your time, and thank you for attending the April edition of the monthly intro to ODG by MCG. Thank you.
Thank you, everyone. I think some of you can hear me, so I'll just end this now and say thank you so much, Ingrid. Thank you, everyone, for attending. I hope you're staying healthy. And if we did not get back to your questions, we will get back to you through email, and you'll receive a recording within 1 week. Thank you so much.
Thank you.
Thank you. Please stand by.